So guys, this episode is really special for me. It's both professional and personal. When you talk about people that are responsible or play a huge role in the success of your careers, this guy's one of them. This guy is Dr. Daniel Barone, author. He and I have known each other since medical school, playing basketball together.
Right.
Was my senior resident, so responsible for a lot of my learning, and was definitely one of the mentors throughout my career. So, Dr. Barone, I'm so happy to have you here.
I am so glad to be here. Thank you so much again for inviting me. I'm very honored.
Yeah, I'm looking forward to having a conversation about sleep. He's a sleep expert. He's also an author. We've got his books here, Let's Talk About Sleep and The Story of Sleep.
From A to ZZZ.
From A to ZZZ. So before we sort of get into, delve into some of the deep topics on sleep, what are some of the myths that people have when it comes to sleep?
Great question. I would say probably the biggest one that you hear about is as we get older, we need less sleep. And people think that 80 years old, I wake up a million times throughout the night. I just must not need as much sleep as I did when I was younger. And while our ability to kind of deal with sleep deprivation does get better, actually, as we get older, right? The need for sleep is still the same. Okay, we may be waking up because to go to the bathroom, or if we have sleep apnea, or if there's chronic pains. These are things that disrupt sleep, but the brain itself needs as much sleep as it did when it was younger.
Yeah, one of the things I tell people all the time is that sleep is made for your brain.
Right.
Right. So, and people at all ages think that they can go without sleep.
That's right. That's right.
And it has significant negative impacts, not just on your brain, but your entire body.
That's right. And there's many studies. Probably the most commonly cited one is about 20 years ago. They took a whole bunch of people, healthy volunteers. They put them in conditions of testing, whether it was either after 8 hours of time in bed, 4 hours time in bed, 6 hours time in bed, or no sleep at all. And they compared them, the amount of mistakes they made on one of those PVTs, those psychomotor vigilance tests, right? So if you see a dot on the screen, you press it, right? If you don't, you don't press it. It's a measure of attention and focus, right? So what they did was they took these 4 groups, again, no sleep, 4 hours, 6 hours, and 8 hours over a period of 2 weeks. And what they found was, of course, after a few nights, the people with no sleep started making a lot of more mistakes. But the people who got 4 and 6 hours per night, their mistakes kept shooting up. But halfway through the study, they asked them, how do you feel like you're doing here? And they all said, I feel like I'm getting used to it. I feel like my brain is adapting to the lack of sleep. But it goes to show we don't. And we sometimes don't even realize the sleep deprivation that we're dealing with.
You talk about that, and what that makes me think about is, damn, our healthcare system.
Right.
Because doctors and nurses.
That's right.
Work through the night.
That's right.
So we're not getting a lot of sleep.
No, we're not. It's one of those heal thyself, right? Physician, heal thyself. And the only way that's going to change is with cultural change. And I think that has to start from from even before we even think about, medical school or so. It really should be a situation where we're taking care of ourselves first. We need
I've had plenty of nights where I've worked through the night.
Right.
And right around like 2-3 o'clock in the morning, I notice I am angrier, more irritable.
That's right.
I feel like I can make a lot of mistakes. Right? Like it just takes a lot more work to focus.
And it's not really something you can kind of retrain yourself to do in the traditional sense. You may notice if you're up at 2 or 3 o'clock in the morning and you're working, you're freezing, right? You're freezing cold. The reason why is because your body temperature normally drops in the middle of the night. And that's a signal that you should be in deeper sleep. And you're awake, so your brain is not there, your focus is not there. Yeah, that's when mistakes happen, unfortunately.
Yeah, see, and I thought that was the heater in my house.
It's
not working properly at that time. I was like, I need to reset this heater.
Right. Well, that may be too.
Yeah. Any other myths that you see?
I would say that's one. I would say that people who say that they are going to be sleep deprived during the week and then make up for it on the weekends, that's probably another big myth. Again, going back to that situation we said before of that study, right? If you're somebody who truly needs 8 hours a night, which most people do, the National Sleep Foundation put forth this study about 3 or 4 years ago. The average person needs between 7 to 9 hours, right? So that's not up for debate. 7 to 9 hours. So if you're somebody who truly needs 8, and let's say during the week you get 6 every night, right? That means by the end of the week you're 2 hours behind. right? So 2 times 5 is 10. So you're 10 hours behind the 8 ball at that point. So if you sleep in for an hour or two on Saturday into Sunday, is that going to make a difference? Not at all. Okay, and the brain doesn't make up for missed sleep that way. It's not a one-to-one relationship. But the point, though, is that you can't make up for lost sleep by sleeping an extra hour or two on the weekend. It just doesn't work that way.
So can you ever catch up?
You can, but it's not as simple as, I'm going to sleep in a little bit on the weekend and I'm all caught up. It doesn't work that way. You'd have to sleep in probably for 8 hours or 6 hours on the weekends, which is not ideal either.
So how much sleep are you getting?
I probably need 7. I probably get 6 and change. So not perfect, but
Listen, doctors make the worst patients.
I know, it's true. It's true.
Because I feel like I need 7.
Right.
Oh man, there are plenty of nights I'm getting like 5.
Right.
Yeah.
Right. Yeah. No good.
So you said everybody needs between 7 and 9 hours of sleep.
That's correct. And it's a bell curve, right? So there are people who need less or people who need more.
Yeah. What happens to people who are just constantly getting more? People who sleep like 10, 11 hours.
Right. You would think that'd be a good thing, right? Like enough more of a good thing should be good. But what happens, though, it becomes a situation where you say, well, why are they having so much sleep? Why do they need to get so much sleep? And that could be something like sleep apnea, right? Repetitive stoppages of breathing are disrupting their sleep. So even though they are getting quantity, the quality is not there. So what I always say, it's quantity, quality, and timing. Those are important. So if somebody's sleeping extra, it could be that they're dealing with a chronic illness or there's something intrinsically wrong with the sleep.
Now you've mentioned sleep apnea a couple of times.
Right.
What causes sleep apnea?
So sleep apnea, obstructive sleep apnea, is a condition where the tongue and the soft tissue are basically falling backwards and closing off the airway, right? So if we say this is a normally opened airway, here's where snoring happens, and then closed off is where sleep apnea happens. And when that occurs, the brain doesn't just let you, choke to death. It says, hey, we got a problem here. And what it does is it causes you to wake up. Or you may not even be aware of it. It may be like go from deep sleep to light sleep. The point, though, is that when you're sleeping, your brain wants to be stably in a deep, restful state, and it's not. And you're constantly kind of going back and forth. And that has consequences both in terms of next day, how tired you are, but also long-term with your heart and your blood pressure and that kind of health, your body health.
So what are some of the treatment options for sleep apnea?
So with obstructive sleep apnea, again, it's the airway is closing off. So what we want to do is we want to force the airway open. The kind of standard approach there is something called the CPAP machine. That's continuous positive airway pressure. And what that is a mask that people wear at nighttime. Either it goes over the nose or in the nostrils, or a bigger one goes over the nose and the mouth. And all this does is it blows pressurized air, not oxygen like they're in the hospital or ICU, but this pressurized air comes in, goes all the way down to the back of the throat, and it forces the airway open. So if somebody's snoring because the airway's tight, that'll take care of it. If somebody has sleep apnea, it'll also take care of it.
Now, we're taught that one of the signs of sleep apnea is snoring.
Right.
So is snoring ever okay?
Right.
Is it ever normal?
So if you look at the numbers, about 40 to 60% of people snore. Okay, Americans snore. 9% of women have sleep apnea, 24% of men have sleep apnea. So not everybody who snores has sleep apnea, and conversely, not everybody who has sleep apnea snores, but it is a good marker of it. So if somebody snores very loudly and they're disturbing themselves or they're disturbing their bed partner, what I would say is just have a low threshold, go get tested. We can do a home test, we can do an in-lab test. There's various ways we can kind of diagnose it. We're not there yet where we can say wearable technology, consumer technology is good enough for this. But certainly just go to your primary care doctor or go see a sleep specialist and get it taken care of.
So what's causing the snoring if it's harmless?
Well, what can happen sometimes is, the snoring that we're concerned about happens down here. Okay, again, the retrolingual airspace where right behind the tongue, the airway gets tight. If snoring is not related to sleep apnea, it can also be because of up here. Okay, so the nasal passages, if there's turbinate hypertrophy or there's extra tissue back there, as the air is rushing by, it causes things to vibrate. That's a more benign case.
So snoring is basically turbulence in your nose.
That can be, right?
Yeah.
Right. Or down here where it's kind of a sign of blockage.
Okay.
Right.
Are there tips that you give people in order to sort of help them if they have something like sleep apnea besides the CPAP or medication? Right.
So medication, we're not there yet as far as keeping the airway open, although that is being developed right now. I would say the key thing is knowing what position you're in when you sleep. If you're on your back, gravity is not your friend, right? So it's going to pull your tongue and your soft tissue to the back of the throat. We want to avoid that. So what I tell my patients to do is try to sleep in the fetal position, on the side with your hips and knees flexed, right? That can kind of keep the snoring and sleep apnea at bay. Alcohol before bed can make it worse. Okay, the alcohol relaxes the soft tissue. Smoking, any kind of, whether it be marijuana or cigarettes or anything, any kind of smoke can irritate the airway, make it tighter. Exercise and weight loss can be very helpful.
Well, it's funny that you mentioned alcohol because a lot of people use alcohol to help them sleep.
That's right. And actually the data shows that alcohol can help people get to sleep, especially if there's anxiety, which in this day and age, is rampant. And even the first hour or so of sleep may be pretty good. But what happens is as the body starts to metabolize the alcohol out, it's almost like a mini withdrawal. And then the person starts to wake up a lot more. The sleep becomes much more discontinuous and the depth of sleep is not there.
So basically you're saying alcohol is not good therapy to help you sleep.
No, definitely not.
Yeah.
No,
See,
definitely.
Alcohol is not good for anything. It's not good for anything at all.
Right. Well, it's interesting because it is a U-shaped curve, right? So if you look at mortality, right, like no drinks is whatever, maybe 1 to 2 per day. And I'm not encouraging this, but 1 to 2 per day is okay. But then when you start getting into more and more, that's when problems happen. But yeah, you're right. The data may even show that no alcohol is probably better.
Yeah, some people will tell you that alcohol is just a poison. So,
right.
So none is better.
Right.
What are some of the challenges that you see some of your patients have when it comes to sleep?
I would say the biggest unmet need right now is an understanding of what anxiety and depression can do to sleep and vice versa, right? I see a lot of patients who come to me and, they really almost don't even have a sleep problem. They have an anxiety problem that's making them not get sleep, right? Either get difficulty getting to sleep or staying asleep. And sure, I can help them, but, really the underlying issue comes down to, having a therapist or having a psychiatrist and going that route. I think that's super important. I think that that's something people don't sometimes recognize.
Yeah, I think you bring up a great point. So a lot of other things can be causing your sleep problems.
That's right.
And it's not a primary sleep issue.
That's right. Yeah. So an intrinsic sleep problem, that's what we just talked about. That's sleep apnea. That's things like restless leg syndrome. That's there are forms of insomnia where that can occur just from the sleep itself. But a lot of times, though, there's other factors that are making sleep worse. So you got to kind of look at the big picture and say, what else can we do here? Chronic pain's another one.
Yeah.
Right.
I think I said to you before that there are plenty of nights I'm getting like 5 hours of sleep.
Right.
There was a night where I got 9 hours of sleep.
Mm-hmm.
I felt freaking incredible.
Right.
I felt like Superman afterwards. I was like, oh my God, I need to do this more often.
Right.
But there are a lot of people that, they get a lot of sleep and they feel a lot more tired after.
Right. So there's a couple things going on there. When somebody, so let's go back to the example we talked about before, where let's say somebody needs 8 hours a night, but they're only getting 6, right? And then the weekends, Friday into Saturday, they sleep, 9 or 10 hours. You would think that even if it doesn't necessarily help them, they shouldn't be feeling worse, right? But they sometimes do. And the reason for that is because when you try to have that make-up sleep, so that you were so chronically sleep deprived, you try to make up for it on that recovery night, as I call it. What happens is you tend to actually get more what we call N3 or delta wave sleep. Okay, and what that looks like is your big undulating waves, brain waves. So you think, what's the problem there? Nature has designed it so that we tend to get that in the first half of the night, not so much in the second half. If you have recovery sleep, like we're talking about, that usually implies you're getting a lot more of that extra deep sleep in the second half of the night. Again, what does that matter? Because waking up out of that can leave you feeling worse. We call that sleep inertia. Everybody's experienced this. You would know it if you ever took a long nap in the afternoon and woke up feeling worse. Yeah, that's what sleep inertia is, because your brain is trying to get that deep sleep, and it is. But when you wake up out of that directly, it can leave you feeling almost drunk in a way.
So what should people do if that's sort of their sleep pattern?
So if somebody does that, I would say the first step would be to try to realign your schedule so that you're not relying on that. So you know what I mean by getting more sleep during the week.
Now, one sleep issue that I have dealt with personally is sleep paralysis.
Right.
which I'm not sure if people know. So if you want to describe a little bit what sleep paralysis is.
So sleep paralysis is it's a feeling where you wake up abruptly either from a nap or in the middle of the night or in the morning, and it's not, oh, I'm tired, I don't feel like moving. It's I physically cannot move. It's like almost like a locked in state where your eyes may be able to move, you may be able to kind of like, you know you're awake, but your body is still asleep and it's paralyzed. It's frightening. It's happened to me a couple times too.
It's scary as F.
It is. It's very, right? Sometimes what can happen is so what's happening there, so, we talked about the different stages of sleep. REM sleep, REM sleep, that's when we tend to dream, okay? And why that's important is because during REM sleep, which we go into, let's say every 90 minutes or so, the brain, as it's dreaming, puts us into a state of paralysis normally. Therefore, we don't act out our dreams. If you wake up out of REM sleep abruptly, what can happen is your brain may be awake or partially awake, but your body's still in REM sleep. So you're paralyzed, right? It takes a couple seconds for you to kind of fight out of that, right? And then you're normal. What can happen though is sometimes people with like narcolepsy, for example, right, which is a condition where people are excessively sleepy, they can have situations where they're getting sleep paralysis regularly. And they also have dream imagery intruding onto the wakefulness. So what'll happen is they'll be paralyzed and they're partially awake, partially dreaming. They'll see a shadowy figure coming towards them and they can't move. That's frightening.
I've had that.
Have you? Yeah.
I've had that. Literally a shadow above me.
Right.
And I'm just like, okay,
right.
Philippe, you know what this is.
Wake up.
And the entire time I'm sitting there like trying to move a finger,
right.
And then I'm like, okay, I can move that one. I'm trying to move the rest of my hand. And it's like a process.
Yeah.
And then I don't want to go back to sleep afterwards because I'm like,
of course, yeah. In a non-narcoleptic person, that can happen from sleep apnea. That can happen from sleep deprivation. That's a big one. Any kind of substance, whether it be alcohol or smoking, can do it. Anything that's going to kind of take you out of normal sleep architecture is what we call it. Anything that's going to take you out of that can potentially cause those things.
And so what's the recommendation for that?
Well, usually they're just, reassurance, it's not, so it's okay. Exactly. Get some sleep, right. but if it happens regularly, that's probably where I would say, look, you want to, if it happens regularly and you're doing the right stuff, I would say you probably want to get an evaluation at that point.
Yeah. For me, I've noticed it's when I'm sleep deprived.
Right. Exactly. Or stressed or,
Right. So if for whatever reason I worked all night, then I know that.
Then you're going to have it,
that there's a good chance I'm going to have it.
And what happens there, it's like, it's almost that kind of the recovery sleep we talked about. It's like this time your brain is getting extra REM sleep. Yeah. So waking up out of that can be problematic.
Yeah. The last time I had that, I called my parents and I was like, how long would it take for you guys to check in on me if you had not heard from me?
What was the answer?
It'd be like 2 weeks.
2 weeks. Yeah.
I was like, that does not work.
Right. No, that's not gonna work.
Do you have any tips that you give people to prepare their bodies and their brains to go to sleep?
I think one of the best things that someone can do, and I'm sure you advocate for this as well, is meditation, mindfulness meditation. I think that can be incredibly helpful. I think it's something that we don't utilize enough. And it's a shame because there's a lot of great apps and resources, the Headspace app, the Calm app, these are really useful and they can be very, very helpful. Even if you start off, I tell my patients, even if you start off with a minute, I can't meditate, try just a minute. Just start with a minute. Even if it doesn't do anything for you, get your brain used to doing that. And then you build up over time. Yeah. That at nighttime or in the middle of the night, and then exercising in the morning. Those two things I think tend to work very well.
Yeah. Things that I tell people that the bedroom, only two things take place.
That's right.
Sleep and sex.
That's it.
Get all the electronics out of the bedroom,
Definitely.
The TVs, the laptops, all of that.
Right. I have patients tell me sometimes they'll eat in their bed or it's like, what I say is, I use this analogy. It's like, you want to think of not only the bed, but the bedroom, it is almost like a sacred space, right? You don't want to do anything in that space that's going to desecrate the temple, or as it were. Yeah. In New York City, where I practice and, you're from, it's not everybody has access to a separate bedroom or, there may be a studio apartment. So that makes it a little bit more challenging, but you can always say, look, I'm not going to do these things in bed until it's time for sleep.
What about eating?
Same.
But how long before their last meal to when they...
as far as, okay. I don't really have a great recommendation on that. I don't have a specific number. What I say about eating and drinking are the following. You don't want to go to bed with starving, right? You don't want to go to bed with ravenous stomach. You also don't want to go to bed right after a big meal. So ideally, I would say you want to give yourself at least a few hours to digest. If you're starving before bed, maybe a little bit of peanut butter or some crackers, maybe some carbs and protein, that may help, satiate you. With water, you definitely want to drink your 8 glasses of water per day. I think that's another thing in medicine we don't often.
No.
But an hour or two before bed, you want to cut that off.
And what about you? Well, you got a lot of people that drink coffee.
Right.
When should their last caffeine intake be?
So that's an interesting question, because there are some people who drink coffee, up until 10 p.m. rather, I should say. And they say, I have no problem. That doesn't affect my sleep. All right, well, you're lucky. Good. But caffeine in some people can have a half-life up to 5 hours. So that means if you have a cup of coffee, let's say at 4 or 5 p.m., it still may be in your system by the time you go to bed at night. Not necessarily that you're going to have a jolt of energy all the way through, but even that little bit of caffeine is recognized by your frontal lobes as being present, and that can be just enough to tip the balance where it won't let you go to sleep. So I would say for anybody who's having trouble, 1, 2 o'clock the latest. Any caffeine.
We had somebody on this show talking about Alzheimer's.
Mm-hmm.
What's the connection between sleep deprivation and potentially developing Alzheimer's or any other dementia? Right.
It's a great question, and it's definitely an evolving field. That right now there's a lot of theories behind it. I would say, in my opinion, the most probably powerful discovery that's been made in the last 10 to 20 years in sleep has been the discovery of the glymphatic system. You know what this is? You've heard of this? Yeah. So the brain doesn't have a way of getting rid of waste the way every other organ does. What was found in rats and mice and then later on humans was during sleep, especially deep sleep, the supporting cells of the brain actually shrink down a little bit. And what this allows for is almost like a convection current to occur in the brain itself, right? And it helps to wash away the toxic byproducts that happen after a day of life. Why this is important is because one of the theories goes that if somebody is not sleeping well for decades, not one night, like some people think, decades of not getting good sleep, the theory is that because you're not getting that deep sleep and allowing that process to happen, toxic proteins, toxic things build up in the brain, and that can be damaging to cells, and that can lead to things like Alzheimer's and Parkinson's and things of that nature.
So what he's saying is that chronic sleep deprivation can lead to degenerative changes, causing things like dementias related to Alzheimer's, Parkinson's, or whatever else.
That's right. Over decades. Decades. Right. So that's kind of what the theory is. I mean, there are other sleep related conditions like, there's some theories suggesting that obstructive sleep apnea, if it's not treated, can also lead to dementia. The brain is kind of in an irritable state, and it's not being able to give it a chance to rest. And then my personal area of research interest is something called REM behavior disorder, which is a condition where we had mentioned before, REM sleep is when we paralyze, right? We are dreaming, our body's paralyzed, so we don't act out those dreams. What can happen, especially in older men, this is a condition of older men, is that paralysis process doesn't occur. So these men, they start acting out their dreams, okay? And kind of the classic example is you got a 75-year-old guy who comes into the office with his bed partner who has a black eye because he was dreaming about fighting somebody and he ended up hitting them in the dream. And you say, well, why do we care about this? Well, of course, we don't want them to hurt. But the real reason we care about this is because that condition, REM behavior disorder, has been associated with Parkinson's disease, Lewy body dementia, 10 years in the future. So all these things are related to brain health.
Do you have patients that you see that you find are more challenging than other patients?
Well, I think probably the biggest thing with sleep is the answer is not always, here's a pill, goodbye. The answer sometimes requires work on both the doctor and the patient's part. So for chronic insomnia, for sleep apnea, these are conditions that require maybe a CPAP machine, or maybe we have to restructure the bed habits, or maybe we have to work on timing. Yes, and we do have medications to help that along, but it's not a quick answer, which is unfortunately, this day and age, what everybody wants, right? So I think that's probably the biggest challenge.
So I mentioned that you wrote 2 books.
Right.
The first one was Let's Talk About Sleep.
That's right.
What was the inspiration behind that book?
Well, I think for me, my biggest passion is education, right? So I have my own YouTube channel for these reasons. I try to just educate the public on sleep disorders. I think it's really important, and it's really something we can do as physicians to help the world. So education has always been my passion. So one of the things I said, I was like, you know what, maybe writing a book would be a good idea. And then, as if the universe spoke to me, as I was thinking about this, my patient a couple days later said to me, Dr. Barone, you should write a book. And it was like, that was all I needed. I was like, all right, let's do this. And that person actually happened to know somebody who knew somebody who ended up becoming my co-author.
That's awesome.
Yeah.
That's amazing.
Yeah. So that's how the first one came about. And then the second one, which was kind of like almost more like a little bit of a dictionary. The first one, you hear the patient stories, you hear the whole chapters, long chapters. The second book, The Story of Sleep, that's a little bit more bite-sized entries, just kind of, be able to pick up and read. That came about because the COVID pandemic, people were, really, I think, hungry for information on sleep disorders. So we said, why don't we just make a little compendium that someone can just pick up and learn about sleep disorders, and they can just put it away. And that's kind of where the second book came from.
Awesome. If there are 5 things that you can tell people to do starting today that would significantly improve their sleep, what would it be? 5
things. All right. Number 1, I would say exercise and meditation. Okay. I think that we are meant to move, and I know that you advocated that as well. We're meant to move. You don't want to exercise too late because that can disrupt sleep. So you want to get your exercise in the morning and then wind down with meditation at night. That's number 1. Number 2 is put away the screens, right? So anything with a screen, a computer, a smartphone, a tablet, even an e-reader in some cases, anything with a screen, what that does is emits blue frequency light. And what blue frequency light does is it tells our eyes, to tell our brain that the sun is out. And what that does, it shuts off melatonin, our own production of melatonin. Melatonin is a hormone the brain makes that lets us know it's time for sleep. So if you're inundating your eyes with screen time before bed, one of the things that's probably not going to get us produced as well as we want it to is melatonin, and that can inhibit sleep. So that's number 2. Number 3, I would say, is be wary of substances. So I call them the big 3. That's alcohol, nicotine, and caffeine. Alcohol and caffeine we just talked about. Nicotine, people should be smoking anyway, but it's a stimulant. So anything around bedtime can disrupt sleep. Okay. 4, I would say consistency. Consistency is really key, right? So we want to avoid what we just talked about, where your sleep is all over the place. Your brain needs to know, this is my time for sleep. This is my place for sleep. I have enough time to get my rest. That's really, really important long term. And then number 5, I would say that this is kind of a little bit tongue in cheek, but no sleep problems are cured overnight. Right? So it may take work, and in some cases you have to maybe be a little bit more thorough and go get a sleep evaluation or talk to your doctor about it.
Yeah.
Those things.
Well, you mentioned melatonin.
Right.
A lot of people will just say, hey, I'll just go to the pharmacy and grab some over-the-counter melatonin.
Right. And there's a lot of I wouldn't even say medical literature, but there's a lot of like internet literature on melatonin. Some people say it's the worst thing. Some people say it's a good thing. What I say is this: it's certainly known to be an antioxidant, which is kind of a good thing. In adults, I take it almost every night myself. In adults, it's safe so long as we're not mixing and matching with other sleep aids, and we're not using it to cover something up. So, for example, what I mean by that is, let's say somebody does have sleep apnea. I keep going back to that, right? And they say, I'm waking up, gasping, I'm snoring throughout the night. I'm going to pop, mega doses of melatonin and see what happens, and just try to sleep through it. That is not recommended, right? Melatonin has been shown to potentially cause hormonal changes in in children going through puberty or pre-puberty. So just got to be aware of that. A lot of pediatricians do recommend melatonin, but I just say you want to make sure you're talking to, somebody who's taking care of your child. Yeah.
So we talked about the 2 books that you have.
Right.
You're doing research REM behavior sleep disorder.
Right.
So what's next? Do you have any other projects coming up?
I just try to keep growing my YouTube channel, which is called Let's Talk About Sleep. I enjoy that. I answer questions people write on YouTube. So if you're interested, YouTube, Let's Talk About Sleep. That's right now probably the number one thing. I am presenting my research at our conference in June this year in Indiana. So I look forward to that. Yeah, just getting the message out as best I can.
Yeah, I get to catch clips of your YouTube channel on YouTube, but also on other social media platforms.
Right.
It's informative, it is relatable, it's easy to digest. So you guys should definitely check it out. Where are some of the other places that people can find you?
So I'm on basically all the social media platforms, Facebook, TikTok I'm on now, Instagram, LinkedIn, and what am I missing?
No.
LinkedIn, Instagram.
Are you dancing on TikTok?
Yeah, right. I don't know. Well, I'm on Twitter as well. Twitter. You can find me just either my name, Daniel Barone, MD, or Let's Talk About Sleep.
Well, what if somebody wants to see you as a patient?
So I work at the Weill Cornell Center for Sleep Medicine. I guess you can give them the number on the 646-962-7378. You can see me there.
Well, it was great having you here. It's always great to catch up. My pleasure. We've got to have dinner or get back on the basketball court at some point.
Definitely, yes.
Guys, you've been listening to Dr. Daniel Barone, a guest on the Surviving Your Brain podcast. We look forward to seeing you next time.